up for Dr. Thomas. Thanks so much.
Wow. Thank you very much for that most generous introduction. Ladies and gentlemen, I'm doubly honored to join with you in this fabulous gala tonight. First, like you, I'm honored to join in acknowledging our three honorees this evening. Pastor Small, Mr. Hunter, Ms. Brousseau, I hope you are feeling the enormous respect everyone here has for you, myself certainly included. Secondly, I'm honored to be with all of you. There are many demands on your time, both personal and professional, that you chose to come and extend your congratulations and your commitment to the extraordinary mission of Bridge the Gap. It means I'm deeply honored to be among you. Now, when Laura Cox extended the invitation to share some thoughts with all of you tonight, I, of course, began thinking of the work and dedication so many of you have put into developing and supporting Bridge the Gap. But as I thought of the larger context of your efforts, I found myself reflecting on a historic antecedent. So in preface to commenting on the educational context of today, let me share some points of similarity to a clinical context of yesterday. Actually, many yesterdays, just over 30 years ago. As you heard in the generous introduction, I was then Chief of Staff in the San Francisco Health Department, a powerhouse group of 6,000 doctors, nurses, hospital workers, clinic and support staff, and more. As an administrator there, I shared with my colleagues the confidence of the day, since all of us had had our clinical training during the height of scientific, medical, and public health optimism, an optimism that I now see bordered on hubris. But after all, our clinical training came during a period in which we confidently noted the near elimination of many childhood diseases like whooping cough and smallpox, not to mention the defeat of the public health scourge of the day, polio. We were certain that eventually we could cure nearly anything. But one day our director of communicable disease came into my office and said she had a real mystery on her hands. She was getting reports of several cases of young men in their early 20s hospitalized at UCSF with a virulent skin disorder extremely rare to see in any patient younger than 60 or 70 years of age. Stranger yet, she was getting reports that these young men had several counterparts in hospitals in Los Angeles, a couple in New York, perhaps several more. You've undoubtedly surmised, correctly, that I'm referencing the very earliest days of what would become a disease of historic proportion, growing with astonishing and frightening speed from this handful of cases to the worldwide pandemic we now know as HIV/AIDS. Now, before I jump back to the present day and to our current educational challenges, let me mention one other point. In fairly short order, though sadly not short enough to save thousands of lives, in a few years in the 80s, we came to a basic knowledge of what we were facing and an early picture of what we could offer by way of prevention or at least mitigation. This gave rise to a real zeal on our part. After all, though we had no cure, we did indeed have sufficient knowledge on how to curtail this epidemic. As public health professionals, we wanted to spread that word as widely and as persuasively as possible throughout the community. We know enough to greatly reduce your chances of infection. We know enough, we would say with fervor, we can save your life. But guess what? All of that clinical and public health knowledge was not sufficient to stop the spread of this disease. Necessary, but definitely not sufficient. A longer story for another night, but suffice to say that the critical ingredient that ultimately slowed the spread of this killer disease was public awareness, community mobilization, and financial and political commitment. Absent that, we were stymied. With it, we made strides beyond our wildest dreams. So now, back to 2012. What draws us together tonight is that our three honorees, and so many of you in this room and beyond, have recognized that there's another dangerous disease lurking in our community. It leaves thousands of children without hope. It saps their energy. It drains their future. Now we're faced with a deadly challenge known not as HIV, but as DID, deliberate indifference disease. Like its earlier counterpart, deliberate indifference disease started quietly and in relatively small numbers. After all, this was California, a longtime home to ingenuity, optimism, creativity, and the country's top-rated, highly regarded public education system. So what has happened? Again, a longer story for another night, but suffice to say that just like San Francisco in the 80s, with the majority of the population healthy and thriving, many of our public health students today are excelling and achieving at a level we all celebrate. But for others, the effects of DID have struck, and for them, it's devastating. Many students are left languishing in the back of the classroom. Others, shockingly, are left to disappear. And because many political leaders, and sadly, many in the community, show signs of deliberate indifference disease, an increasing number of students have their innate capabilities, indeed their lifetime successes, slowly becoming irretrievable. This is where Bridge the Gap comes in. And this is why we're here tonight celebrating. Because like the clinicians of years ago, the staff and volunteers of Bridge the Gap have critical life-saving techniques. They have the zeal and commitment to offer them. Indeed, they too can proclaim with fervor, we can save your life. But like the lessons of yesteryear, we must acknowledge that educational expertise, even when combined with the fervent wish to be of help, is not sufficient. Necessary, but not sufficient. Once again, what is needed is community mobilization, a virtual public health campaign that commits to eradicating deliberate indifference disease. And a first step is immediately speaking up when signs of DID surface in our own community. There was no cure for HIV, and it's unlikely that there is one for DID. But with determination, deliberate indifference disease can be slowed, curtailed, and its effects mitigated. So, for example, when a pundit proclaims that we're spending too much per capita on the students at Martin Luther King Academy, we call it out. We would say back that if you really knew of the life challenges, of the social and familial effects of racism, if you knew the burdens these young children sometimes must bear, you would join us instead in calling for a doubling or tripling of that per capita expenditure. So this is why I'm so proud to be among you tonight. The staff, volunteers, and supporters of Bridge the Gap, and their counterparts and sister organizations, working closely with concerned administrators and teachers, are truly in the vanguard of restoring both educational achievement and social equity. We know that this can be done. There are repeated educational success stories here in Marin and across the country. Those of you doing this work are heroes. You've made a commitment to be present in these children's lives, to offer them not just tutoring, but dreaming. Not just occasionally, but continually. You tell these young people you believe in them, that you'll help them, that you'll dream with them, and that you'll stand with them. In this, you are very powerful. One last point. Some time ago, the durable pop singer Madonna. Durable. Enduring, yes. Madonna wrote a song in which she said that the most powerful word in the English language is goodbye. That's haunted me for years. But founders, staff, and volunteers of Bridge the Gap, you've proven that there actually are two even more powerful words. I'm here. This is what you've been saying for 17 years to young people who so poignantly need your help. I'm here, you say. I'm here. Nothing could be more powerful, and all of us, trustees and staff of the Marin Community Foundation, are enormously proud to support you. Thank you. Good evening.